A new patient has scheduled an emergency appointment and is traveling out of state for 2 days. He is experiencing pain in his lower right tooth. Upon examination, it was discovered that the tooth has a broken filling with no swelling in the gum or at the root and no inflammation of the lymph nodes. Let's explore the immediate and definitive treatment options.
In this case, we must understand the emergency of the situation. We must explain the short and long-term options if time permits. We must also explain complications of infection or leaving tooth untreated. Now let's dive into the role play. Okay, Mr. Smith, let's sit you up now. Thank you for letting me have a look. Just recapping, how did this filling break?
I was having my regular meal and I heard a pop and felt a bit of pain afterwards. Now I feel like the food is getting stuck there.
Oh, that sounds painful. When did this happen?
About 3 days ago,
Can you describe your pain? Is there anything that makes it worse or better?
it feels sharp sometimes, especially when I have something cold to drink.
Oh, okay. Have you taken anything for the pain?
Yes, I've been taking Nurofen for the last 3 days when the pain started. That seems to help it.
All right. Do you take any medications on a regular basis or do you have any allergies?
I don't take any other medications. I have no known allergies that I'm aware of. I just want this pain to go away.
Oh, I'm so sorry to hear that you're in pain, but it's also good to know that you're otherwise fit and healthy. Now let's discuss about what's happening with your tooth. It appears that you have a broken filling in this tooth, but I don't see any swelling in the gum or at the root. I've just taken an X-ray which also shows the broken filling, but there's no infection at the root end.
Okay, that's a relief. What do you suggest we do?
We have a few treatment options. One immediate option for us is to remove the remaining filling material and we place a temporary filling to alleviate the discomfort until you can schedule a more definitive treatment.
Okay, that sounds manageable. Will this fix my problem?
Now, the X-ray shows that the previous filling is not very deep, hence we should be able to alleviate your pain. But if you start experiencing pain or sensitivity at a later stage, we might then have to look into doing what's called as a root canal or maybe remove the tooth to address any damage or infection that's within the tooth.
Oh, but I don't want my tooth to be taken out. I hope the filling helps me.
Yes, it should definitely alleviate some of the discomfort. But remember, it's important to keep in mind that the broken filling may have exposed the inner layers of your tooth, so that makes it more susceptible to sensitivity.
I'm already in pain. Will it hurt when you do the filling?
I will do my best to make this a very comfortable experience for you, Mr. Smith, but we will first have to numb the tooth up and then proceed with the filling. Does that sound okay to you? Do you have any other questions for me, Mr. Smith?
That sounds like a plan. Are there any precautions that I need to be aware of?
I would say it's a very fairly straightforward procedure, but be careful while biting on this tooth after today's treatment because it could still be a bit sensitive. And if you notice any signs of infection like fever or swelling, you must see a GP or you have to try and seek help from the emergency department.
Thank you for explaining everything clearly. I would like to proceed with the filling today.
You're very welcome, Mr. Smith. Now let's go ahead and let's get started with this temporary filling. If you have any further questions or concerns, do feel free to ask me, okay?
Cool. Mrs. Smith, a 40-year-old